On the morning of May 20th, 1999, a group of skiers set out into the mountains near Narvik, Norway. Among them was a 29-year-old radiologist named Anna Bagenholm. The weather was clear, but the cold was sharp enough to bite through gloves. She had skied this region before, comfortable with the terrain and the risks it carried. None of her companions expected the day to become a medical case studied for decades. The trail wound past a frozen stream, its surface deceptively solid under a thin layer of snow. What waited beneath that ice would soon become the center of her survival. Norway's backcountry trails often cross frozen waterways, especially in late spring. Locals know these crossings by instinct, testing the ice before stepping fully onto it. Anna and her two friends were experienced skiers, not reckless amateurs. But an unusually warm week beforehand had softened the ice more than anyone realized. Beneath the surface, a fast-moving current continued to carve through weakened ice. This hidden danger is common in early-season backcountry skiing across Scandinavia. It set the stage for what would happen only minutes later. As Anna skied across the frozen stream, the ice gave way beneath her. She plunged into the freezing water, the current immediately pulling her downstream. Her two companions rushed to the edge, but the opening in the ice was too small to pull her through. The water was near freezing, cold enough to stop breathing within seconds of shock. Anna instinctively found a small air pocket beneath the ice, keeping her face above the surface. Her friends could see her, but the ice sheet above trapped her firmly in place. It was the beginning of what would become nearly 80 minutes underwater. Cold water immersion triggers an intense physiological shock response in the human body. Breathing becomes rapid and uncontrolled, heart rate spikes, and panic sets in almost immediately. Anna, trained as a physician, managed to steady her breathing enough to survive the first crucial minutes. Her friends worked frantically at the ice, unable to break through fast enough with their hands. Every minute in that water lowered her core temperature further and further. Search and rescue would take critical time to arrive at this remote location. What kept her alive in those minutes was as much instinct as it was training. Beneath the ice, Anna found herself in near total darkness, the current tugging at her limbs. She used a small pocket of trapped air to breathe, rationing each breath carefully. Her body temperature was already dropping rapidly, the cold sapping her strength by the second. She could hear muffled shouting from her friends above, though she could not reach them. The world beneath the ice was silent except for the sound of moving water. Every attempt to push upward against the ice failed, the surface too thick to break. Time became difficult to track as her mind slowed under the effects of hypothermia. Hypothermia unfolds in predictable stages, beginning with shivering and mental fog. As the body cools further, shivering stops entirely, and consciousness begins to fade. Anna's medical knowledge gave her an unusual awareness of what her body was experiencing. She understood, even as her limbs grew numb, that time was working against her. Her friends above continued digging at the ice, refusing to give up the rescue attempt. Every passing minute reduced the odds of finding her alive when help arrived. What happened next depended entirely on how quickly professional rescuers could reach the site. After nearly 40 minutes, a rescue helicopter reached the remote mountain location. Trained mountain rescue personnel began working immediately to free Anna from the ice. They used specialized tools to carefully break through the thick surface without harming her. By this point, Anna had gone completely still, her body no longer visibly moving. Rescuers had no way of knowing whether she was still alive beneath the ice. The extraction process required painstaking precision in the freezing conditions. Every second mattered, but rushing risked further injury to her fragile state. Mountain rescue teams in Norway train extensively for cold water and ice emergencies. Their equipment includes ice saws, flotation tools, and rapid warming medical supplies. When they finally broke through, Anna was pulled from the water with no pulse detected. Her body temperature had dropped to levels rarely seen in a living patient. Standard protocol treats hypothermia victims as potentially alive until proven otherwise. This principle, sometimes summarized as "no one is dead until warm and dead," guided their next actions. Anna was airlifted immediately toward the nearest hospital equipped to treat her condition. During the flight to the hospital, Anna showed no signs of a heartbeat. Paramedics performed continuous CPR, unwilling to stop despite the grim signs. Her skin had turned pale, her body rigid from the extreme cold exposure. In ordinary circumstances, this would be classified as clinical death without hesitation. But severe hypothermia changes the rules doctors normally rely on for resuscitation. The body's extreme cold had effectively placed her in a state of suspended metabolism. This slowed her cells' need for oxygen, offering a narrow chance of survival. Medical literature describes hypothermia as a unique protector against oxygen deprivation. As the body cools, the brain's demand for oxygen drops significantly. This effect has allowed some victims to survive far longer than would otherwise be possible. Anna's core temperature was recorded at just 13.7 degrees Celsius upon arrival. It remains one of the lowest body temperatures ever recorded in a human survivor. The hospital team prepared for an emergency procedure rarely used outside extreme cases. What happened next would determine whether Anna had any chance of survival at all. Anna arrived at Tromsø University Hospital, one of the few facilities equipped for this crisis. A specialized cardiac team prepared to place her on a heart-lung bypass machine. This machine would slowly warm her blood outside her body before returning it. Rewarming a hypothermia victim too quickly can cause fatal complications to the heart. The team worked with extreme precision, aware that speed and caution both mattered equally. Anna's condition remained unchanged, still without a natural heartbeat of her own. The next several hours would decide whether she could be brought back at all. Extracorporeal warming works by circulating a patient's blood through an external machine. The machine gradually raises blood temperature before returning it to the body. This method allows for controlled rewarming without shocking the heart into failure. Doctors monitored every fraction of a degree as her temperature slowly climbed. Anna's youth and physical fitness were considered key factors working in her favor. Still, no one on the medical team could say with confidence she would survive. Hours passed in tense silence as the rewarming process continued step by step. After nearly 3 hours, Anna's heart began beating on its own again. The medical team watched the monitor carefully, confirming a steady natural rhythm. It was a moment few in the room expected to witness after such prolonged cardiac arrest. Her body temperature had finally returned to a survivable range. Still, doctors knew the fight was far from over at this stage. Extended oxygen deprivation often causes severe and lasting neurological damage. The coming days would reveal how much of Anna truly remained. Cases of hypothermic cardiac arrest lasting this long are exceptionally rare in medical history. Most patients who experience this level of cold exposure do not survive resuscitation. Anna's case would later become a reference point in cold water rescue medicine. Her medical team remained cautiously optimistic but avoided premature conclusions. Family members were informed of the situation, warned that recovery was uncertain. The hospital placed her in intensive care for continuous monitoring and support. What came next was a long and uncertain road toward possible recovery. In the days following her rescue, Anna remained in critical but stable condition. She had suffered significant nerve damage, leaving her unable to move her hands or feet. Doctors were uncertain how much function she would eventually regain, if any. Her case drew attention from medical specialists across Europe studying cold water survival. Anna, still a physician herself, approached her recovery with clinical determination. Physical therapy began slowly, focused on regaining even the smallest movements. Progress was measured in days and weeks rather than sudden breakthroughs. Severe hypothermia survivors often face long recovery periods involving nerve and muscle damage. Extended oxygen deprivation to extremities can result in lasting or permanent impairment. Anna's determination to return to medical practice motivated much of her rehabilitation. She underwent extensive physical therapy over the following months at the hospital. Slowly, Function began returning to her hands, though recovery remained incomplete for some time. Her case was documented extensively for its rare combination of survival and recovery. It offered new insight into the limits of human endurance in extreme cold. Remarkably, Anna eventually returned to work as a radiologist at the very hospital that treated her. Her recovery, while gradual, allowed her to regain most of her physical abilities. She continued to specialize in trauma and emergency imaging within her medical career. Colleagues described her experience as a profound influence on her approach to patient care. Anna rarely sought public attention, preferring to focus on her medical work. Her case, however, continued to circulate through international medical journals and conferences. It became one of the most cited examples of extreme cold water survival on record. Medical researchers have studied Anna's case to better understand hypothermia treatment protocols. Her survival helped shape emergency response guidelines for cold water rescue situations worldwide. Rescue teams now reference her case when training for similar mountain emergencies. The phrase used by her rescuers, "treating no one is dead until warm," spread through medical practice. Anna's story demonstrated that extreme cold, while dangerous, could also preserve life under the right conditions. Her recovery remains a benchmark for what the human body can endure and overcome. It continues to inform how rescuers approach victims of extreme cold exposure today. Anna Bagenholm's case remains one of the most studied cold water survival stories in medical history. Her recorded body temperature of 13.7 degrees Celsius still stands as an extreme medical benchmark. Researchers have used her case to refine rewarming techniques for hypothermia patients. It demonstrated that extended cardiac arrest under cold conditions does not always mean death. Medical teams around the world now train specifically for cases resembling hers. The location where she fell remains a quiet reminder of that day in 1999. Local rescue teams still reference the incident during ice safety training sessions. The physiological process that saved Anna is often called the mammalian diving reflex. This natural response slows heart rate and redirects blood flow to protect vital organs. It occurs most strongly in cold water and in younger, physically fit individuals. Anna's training as a physician likely helped her manage panic during the initial fall. Her survival reshaped emergency medicine's understanding of cold exposure limits. It also highlighted the importance of never assuming death too quickly in cold water incidents. Her case remains a reference point whenever similar rescues occur today. More than 2 decades later, Anna Bagenholm's survival is still discussed in medical training worldwide. Her case proved that the boundaries between life and death are not always fixed. It showed that extreme cold, often seen only as a danger, could also become a form of protection. Rescue workers, doctors, and researchers continue to reference her recovery in extreme cases. The frozen stream where she fell remains largely unchanged, quiet and unremarkable to passers-by. Yet it holds the setting of one of medicine's most remarkable survival stories. Anna's experience continues to remind medical professionals never to give up too soon. Her story is frequently taught in emergency medicine and wilderness rescue courses today. It serves as a powerful case study in the resilience of the human body under extreme stress. Anna's own medical background gave her a rare perspective on both surviving and later studying her ordeal. She remains a quiet but significant figure in the history of cold water rescue medicine. Her case reshaped how rescuers and doctors evaluate victims of extreme hypothermia. It stands as proof that survival sometimes depends on both science and sheer human endurance. Beneath the ice that day, against all odds, life found a way to continue.